Good day everyone, my name is Catherine Bacol Jr., Section 11N from Davao Doctors College, and I am here today to perform and demonstrate the general survey and nursing interview. So nursing interview is done to determine the client's current health status by obtaining objective and subjective data in order to formulate an effective nursing diagnosis and appropriate nursing intervention to address abnormal findings noted from the client. So now, I'm gonna review the client previous medical records if available because reviewing patients' medical record offers the opportunity to identify instances of harm and patients had to undertake quality improvement to improve patients' safety. So now, be prepared for necessary equipment and such as the hospital's comprehensive health assessment and a pen for taking note of the client's data. This doing will save the time and the assessment will go smoothly. So, after doing this, just perform a hand washing. So I have done a thorough hand washing earlier. It seems that there is no sink available in here. So I'm just going to use alcohol for antigen and I'm also done doing by that. So this is done to determine the spread of microorganism. So now, hello ma'am, I am Catherine Bacol Jr. Are you comfortable with your seat right now? Okay, so welcoming the client and significant often help them feel at ease and less frightened. So ma'am, again, I am Katar Bacola Jr., your nursing student, and my shift is 4 p.m. to 11 p.m. So, what is your name, ma'am?
Yes, I'm here.
Okay, so now, how would you like me to call you, ma'am?
I'm calling back.
Oh, okay, then I'm gonna put here that. It is the best to ask the clients from different cultural backgrounds may have certain expectations about how to address and one another. And so, Ma'am Beth, I am going to conduct an interview, particularly asking some questions about your health status and personal circumstances, personal backgrounds, as well as your personal circumstances for me to help with your concern. In addition, your answers will be documented in the data that will be gathered, will remain confidential. Would that be okay, ma'am?
Yes.
Okay, thank you. So this because explaining what to do reduces apprehension and facilitates cooperations. It also promotes the patient's autonomy. So ma'am, in what language do you prepare?
We prepare Tagalog and English.
Oh, Tagalog and English. So we all know that effective and clear communication with me and my patient is essential to provide the best care possible for patients. So, do you have any speaking disability by chance? Any problem with hearing, ma'am? Okay, no. So, ma'am, do you have any concerns to also clarify before we start the interview? No. Okay. So, if you have any concerns, ma'am, later, please don't hesitate to tell me or you can ask me right away, okay? So, for the clarification, it is important in many situations, especially then, what is being communicated is difficult in some way. So, ma'am, are you comfortable in that position?
Yes.
Is there something that you need to, or the room temperature, or it's okay with you? Okay, I really need it. So, providing the atmosphere that helps the patient feel at ease despite any physical discomforts to encourage the patients and help them overcome the feelings that they are disliked or disapproved of. So ma'am, I will be beginning an interview and open-end question that allow your freedom of a response. So ma'am, what is your full name?
My full name is Bethany Joy Picky.
Okay, right here. Bethany, this is a new name. Your age?
18.
18 or 2 now. Where do you live?
I live in Boulevard, Davao City.
Boulevard, Davao City. Date of birth?
July 9, 2004.
July 9, 2004. Your place of birth?
Tandag City.
Tandang City. So your marital status?
Single.
Single. Your gender?
Mm,
Female. Your contact information, ma'am?
0969
Your nationality?
Philippines.
Filipino. Your religion?
Baptist.
Baptist. So, language you speak?
I speak Bisaya Tagalog.
Your educational level naman?
First year college.
Bisaya, Tagalog, and English. Education, college. So ma'am, what brought you to hospital today?
Stomach ache.
Oh, stomach ache. So can you tell me more about it?
Um,
Or sometimes you move or you feel pain?
when I move, I feel pain.
Oh, okay. That is very necessary, ma'am. Can you describe to me the pain that you're experiencing, or if you have a stabbing, dull, or a cramping? What kind of pain is that?
It's squeezing and numbing.
Also squeezing and cramping. So, okay. So, how long have you been having this pain?
It's been 4 days now.
Ooh, it's been 4 days. So now, ma'am, where exactly is the pain that you are experiencing located? Can you point it out?
Here.
So does it appear anywhere?
Yes.
Only that side.
Yeah.
Okay. So ma'am, I'm gonna tell you that is your upper quadrant. Okay. So how long does it usually last?
It lasts 20 minutes to an hour.
Okay, so 20 minutes to an hour. So I forgot this is an upper right quadrant. I think from the okay, ma'am. So does it recur, ma'am? Does it recur? Oh, sometimes. Mm. How bad is it?
If I rate it from 1 to 10, I rate it 7.
Ooh, okay, 7. So 10 is being worse than 1 is being, so your rate is 7. So does it help you somehow?
Yeah, it helps me when I use heat pads to
Wow.
lessen the pain.
Okay, what are the factors that make your stomach pain worse? Do you have something in it that can cause
When
pain?
I eat greasy foods and carbonated drinks.
Okay, so do you let your food to be fully digested before doing anything like what?
After I eat, I sit and lay down.
Okay, do you eat, you can sit and lay down. So, do you have take any medications?
Yeah, I take over-the-counter medicines like loperamide, Imodium.
Loperamide.
Yes, and Pepto-Bismol.
Ooh, that's good.
That my
Imo-
friend suggested.
One again, Bepto, Bismol,
Yes.
then
Loperamide, Imodium.
Imodium. Nice. Who suggested that, ma'am?
My friends.
Your friends. Does it help you?
Yes.
Okay. So, are there any other symptoms along with your stomach pain?
No.
Oh, okay. You feel something dizzy or something like that?
When I'm on my way to the hospital, I feel dizzy and the urge to vomit.
Oh, okay. It must be hard for you, ma'am, no? So, does the pain in your stomach affect your daily activities? Activities, rather.
Yes, especially my studies.
Oh, your studies. So, I see. How does it affect your studies, ma'am?
Like
You miss your class, like
yes,
that?
I miss my class.
Okay. So, ma'am, I am going to ask about your past health history. Just answer a little bit just question as far as you remember, okay? Okay. Have you had the same problem before?
Yes.
Yes. Have you had the same childhood illness like chicken pox, like whooping cough? Oh, no. Have you had your immunization or recently vaccines?
Yes.
What kind of vaccines are there?
Pfizer.
Pfizer. Ah, okay. For the COVID, right?
Yeah.
Okay. Have you ever been admitted to the hospital? No. So, have you undergone surgery before? Oh. Have you been in an accident before
No.
that need immediate surgery, hospital care? No. Okay. Do you have allergies to food? Allergies in drugs? Okay. Oh no. So, okay, ma'am, I will be asking you questions about your family health history. Some health problems are genetically based. It is important for us to know this because it might show clues about your current health status. So, are you ready? Okay. Do your parents have any genetic disease like diabetes, tuberculosis, or high blood pressure? Not all of them, like on the side of your father and mother.
On my side of my mother,
Hmm?
my lola has a high blood pressure,
High blood.
and my cousin has an asthma.
Okay, so how about your other relatives or any family members? Will they have disease or illness? Like your cousins?
My cousin has
Okay, your cousins. Someone with asthma or cancer?
asthma.
Asthma. Oh, who's in an asthma?
My baby cousin.
Oh, it's your baby cousin. So, okay, I'm back. The next questions are quite personal, and it's up to you to um, answer, or if you choose not to answer, then I respect it. And I assure that the information will remain confidential. Is it okay, ma'am?
Yes.
Okay. Is there anything at home that stresses you, or can you tell me about it?
No.
No. Okay. So how do you manage your like daily lives, like if you don't have stress like that?
By playing volleyball.
Okay. You're playing volleyball. Do you have any eating disorder? No. Okay. Ma'am, I will recall all your answers. No. Eating disorder. Stressed by the volleyball. Okay. Thank you. So, being eating, do you eat your meal on time? Do you eat enough food?
I eat my meal on time.
You eat your meal on time. Have you been in therapy before? No. That's good to hear, ma'am. How frequently do you see your friends?
Twice a week.
Twice a week. Do you have a good relationship with them? Okay, that's good. So now, your current lifestyle, ma'am, I'll be asking about your current lifestyle. What would that be okay with you? Okay, so I suppose to that you're a student, am I right? Okay, what education level are you now? In college. So, how's college? Are you doing well? Oh, you're doing well. Do you smoke? Mm. Do you take any drugs? Drink alcohol?
I drink alcohol occasionally.
Occasionally. So, and in football, education level, doing well at college, smoking, no, drugs, no, drink alcohol occasionally. So, do you exercise regularly, ma'am? Or do you have not regularly?
Like twice a week.
Twice a week. Twice a week. Hmm. Are you sexually active? Oh no. So, what food do you usually eat on a particular day, like breakfast, lunch, or dinner?
I eat fruits and vegetables.
Fruits and vegetables. That's very good. So, ma'am, now I will be summarizing all of your information obtained during our working phase. So, we are almost done. So, please allow me to summarize and present all of the information that I have gotten to you during the session. So, feel free to correct me if there is something wrong with me with the information. Okay? So, let us all know that this is to ensure the validity, the accuracy of the data that is established and obtained. So, I'm gonna back this. So, ma'am, your name is Bethany Kita. And then, you speak language is English, Tagalog. Okay. So, you have a concerns, none. Your age is 19. 18, right?
I 18.
18. Okay, thank you. So, you live in Davao City, Bolivar. And then, place of birth is in Tandag. Date of birth is July 9. Okay, July 9. Then marital status is, single. Gender is female. Contact information. Nationality is Filipino. Religion is Baptist. Language you speak is Tagalog and English. So education. Okay, so yeah. The education level is college freshman. So, okay. So again, the state of your stomach is in the right upper quadrant, right? Okay. So, is there anything that you want to correct or any concern clarification, ma'am? Okay.
something to hear.
So, Ma'am Beth, we are done. So now I will give the data to the physician. So please don't worry. Be comfortable. Rest assured that the information you will give is only the healthcare and medical staff and will remain confidential.
Thank you so much.
Okay, do you have any concern before we end this, ma'am? Okay, we will just call you right away and thank you for the interview and test that you need to take, okay? And thank you very much for cooperation and have a good day and take care. So, after that, perform a hand washing and thank you so much.